One of the most common symptoms we see with hypothyroidism and Hashimoto's is fatigue. But the problem is, whenever we're given a diagnosis of low thyroid, whenever our symptoms flare up and we go to see our doctor about it, they're going to tell us that it's due to changes in our thyroid hormone levels. However, people are not defined by the textbook and they're allowed to have more than one thing going on at a time. In today's video, I'm going to go over the 3 biggest keys to overcoming fatigue and exhaustion when it comes to hypothyroid and Hashimoto's related symptoms. If you want to learn about more ways you can support your thyroid, especially if you've been dealing with Hashimoto's, and you want to naturally improve your energy and lose weight, make sure you subscribe to my channel and ring the bell. That way you'll be notified of my videos when they're posted every single Thursday. My name is Dr. Bodle, and my clinic specializes in helping women with chronic thyroid symptoms get results naturally. And the way that we do that is we help them understand the root cause of their problem and develop a specified and individualized plan for their needs. One of the things that we focus on is the fact that some of the symptoms people are experiencing are multifactorial in nature, and fatigue is one of those symptoms. It doesn't have a clear-cut answer for exactly where it's coming from. So we have to make sure that we assess the body as a whole, and to do that, we need to look at a couple key areas. Let's start off with the gut. Most people don't understand or appreciate how much our gut can influence our energy levels, and it's primarily through modulation of inflammation and inflammatory cytokines. If our gut is doing well and inflammation is low, then our body will operate normally. But if there's any kind of disruption or irritation, that inflammation is going to have wide-reaching impacts on the way our energy production occurs inside of our cells. A great example of how inflammation can affect our energy levels is if you've ever had a concussion or you've been sick for an extended period of time. Both of these situations will increase our inflammatory levels, albeit by different mechanisms. The concussion by the injury and the sickness due to the increase in our immune system function. However, we know that in both these situations, it can leave us feeling very lethargic and sluggish because of that inflammatory load and the way that it interacts with our physiology. But how do we go about limiting inflammation in our gut? And the first way is to avoid inflammatory foods. In general, I recommend that people adopt a whole foods diet, avoid processed foods with multiple ingredients in it, and shop the edges of the grocery store. However, for people with autoimmunity and Hashimoto's, they may need to go a couple steps further and eliminate some of the foods that we traditionally think is healthy, but can be a little bit harder for those people's digestive system to tolerate and deal with. Avoiding gluten and dairy is a must, but that may need to be expanded to things like soy, corn, non-gluten containing grains, nuts and seeds, nightshade vegetables, and eggs. The next issue that can be tough on our gut is we might be choosing the right foods, but our body can't actually break it down. So whenever we have low thyroid, that means that the metabolism of all of our cells isn't where it should be. So if we're talking about some of the cells in our digestive tract, we might not be creating enough digestive enzymes and hydrochloric acid to be able to break those foods down into component parts that won't irritate our system. If you're having bloating and digestive symptoms within 30 minutes of eating, some things you may want to consider is eating smaller portion sizes with each one of your meals, chewing them more thoroughly, or potentially adding a digestive aid like digestive enzyme supplements or things like apple cider vinegar if you tolerate it well. The last thing that can be a big hitter to driving inflammation in our gut is gut dysbiosis and possible infection. So you can do testing for this sort of thing, but oftentimes I will take my patients through a progression where we first change their diet, we do some basic support for their gut, and if that doesn't resolve their symptoms, then the likelihood of dysbiosis and infection becomes much higher. Some of these cases of dysbiosis will resolve with those simpler strategies. However, if we don't see improvement, then we can move into the area of trialing specialty diets like low FODMAP or using antimicrobial supplements. Not everyone's microbiome will respond in the same way, nor will each individual be able to tolerate all the different antimicrobials. Therefore, I recommend you find a couple different options that work well with your system and use them for 1 to 2 months. Once you complete that trial period, you can then discontinue the supplements and see how you feel. If you need to reinstate them later, you can always do that. Some common herbal antimicrobials that people like to use include things like oregano, garlic extract, wormwood extract, and berberine. The next key to improving our energy is supporting our adrenal system. And before we get into the details of how to do that, I'd just like to say that I do not do adrenal system testing with my patients. Yes, I know we have options out there like the dried urine analysis and salivary testing. However, I think most of the time we can determine if there's changes in our adrenal system by just looking at the patient's history and listening to their symptoms. So instead of putting a lot of money into a test that might not change our plan, I'd rather have my patients put their effort towards actually making changes for their health. So what do those changes include? The first one is stabilizing your blood sugar. I know, I talk about it all the time and you guys are probably getting sick of it, but it's so important and it has wide-reaching effects for every cell in our body. Every cell is going to be burning glucose, and if it doesn't have the appropriate amount, we're going to have problems. When it comes to our adrenal glands and blood glucose, these are intimately related. And the reason for that is because cortisol has a direct effect on our blood sugar levels. The more we consume refined sugars and high carbohydrate foods, the more stress we're going to put on our adrenal glands, and when we actually need it to crank out some cortisol to support our energy levels, it won't be able to do that in as an efficient of a manner. Instead, as we said before, focus on a whole foods diet and increase your intake of protein and healthy fats. These will be more satiating and they will stabilize your blood sugar over the long term. That way your adrenal system isn't as stressed. Next, find ways to support your electrolytes. When we have changes in adrenal function, we tend to lose salt in our urine, and that can lower our blood pressure and lead to a whole host of symptoms. I typically recommend that people take a quarter teaspoon of salt, so sodium chloride, a quarter teaspoon of potassium chloride, and about 100 to 200 milligrams of magnesium and mix it into water. About 32 ounces is a good place to start at. People who really need the electrolyte support won't mind the flavor, but if it's a little too much for you, add 2 tablespoons of lemon juice and a dash of stevia to help cut back on some of the unpleasantness. I mean, we want to do the right things for our health, but we don't want to make ourselves miserable in the process of it, and I think we can all agree with that. The last thing that we want to do to make sure we're really supporting our adrenal system is to make sure we're not dealing with any sort of infection. So this could be, like in the last section, some sort of gut dysbiosis, or it could be a latent viral infection that hasn't been properly addressed. If we need to address our gut, then go back to the last section and review some of those strategies. But if we're dealing with something like Epstein-Barr, or chronic herpes, or recurrent UTIs, another approach may be supporting your immune system with things like vitamin D, vitamin A, vitamin K, and glutathione. If that doesn't help, you may want to consider that a lot of times people with recurrent infections are dealing with a lot of emotional stress. So we may have to come at it from a mindset of saying, how can we reduce emotional stress in our life and how can we better manage it? But what do you guys think so far? Have you noticed that there's other factors besides your thyroid function that contributes to your fatigue? Let me know in the comments below and tell me if there's any strategies or tools you've used to help improve your energy levels. The third key to improving your energy levels is iron status. Now, the reason we're talking about it last is because it can be dramatically impacted by those first 2 categories. However, most doctors don't correctly interpret these tests, and there's a couple things that I want you guys to understand. It's very common for people with low thyroid to have poor iron status, and there's 2 reasons for that. The first is when we have changes in digestion, it makes it harder for us to break down our food and liberate iron from that food so it can be absorbed into the system. The second is that many women have changes in menstruation, which leads to an increase in blood loss and therefore an associated decrease in iron. Sometimes these 2 scenarios can be occurring at the same time and compound the negative effects. When this happens, it dramatically decreases our TPO function, which is the enzyme in our thyroid gland that helps to assemble thyroid hormone, and it is heavily dependent on iron. Additionally, our red blood cells need appropriate iron levels to bind oxygen molecules in our lungs and transport it around the body. But how do you know if you have enough iron? Most people, when they go get tested for it, are only checked for serum iron, but that only represents about 1% of the total iron status in the body. Instead, I recommend people get a full iron panel, which looks at serum iron saturation, total iron binding capacity, and ferritin. But even if those levels are normal or high, there's one more thing I want you to consider. Iron levels on our blood panel can be influenced by inflammation. ferritin especially. So if we have some sort of inflammatory process, like in the case of autoimmunity, ferritin can actually elevate and give us a false reading for what our iron status should look like. What I recommend doing is assessing inflammation on your labs, implementing a care plan, then following up with your iron panel again on the second set of labs. If your inflammation has decreased, you'll know that the numbers you're looking at in regards to your iron panel are a more true representation of where your levels are actually at. Once you have a better bead on things and you know you're looking at a more accurate reflection of your iron stores, now is the time to assess ferritin. Ferritin represents stored iron, and once inflammation is accounted for, it's a good marker to use to know whether or not your iron replacement strategies are working. Now make sure you work with your doctor on this, but most labs are going to range ferritin from 15 to 150. And let me tell you, if you're down in the 15, 20, 25 range, that is a significant marker for low iron, even though you're not lab low yet. In fact, the World Health Organization has recommended that women be above 50, and some more recent research has suggested that levels near 100 might be more optimal. Again, we have to be a little careful in these situations because taking too much iron can be problematic, but it may be worthwhile for you to work with your doctor and do a trial of supplemental iron to see if it changes your symptoms, especially if only addressing the thyroid hasn't given you complete resolution. So when it comes to fatigue, yes, our thyroid is important, but don't forget the 3 keys that we discussed today: gut function, adrenal system, and iron status. If you're excited about making some changes and getting your energy back on track, make sure you check out my free download, which is 109 foods to boost your thyroid and improve your energy. And you can get that at the link in the description below. I hope you guys liked this video, and if you did, make sure you give it a thumbs up, share it with a friend or family member, and subscribe to the channel. As always, I'm Dr. Brad Bodle, and I will see you guys in the next video.